and Spidey and the team comprised of the team from Laos PDR and from overseas. Before we are going to see the results of the research, I just would like to give more information about the project. This project was conducted in Nong district. It is actually there was one bigger program, and this project is part of that bigger program. And this is in collaboration with Canteen project, managed by MCNV. And this program was actually started during COVID-19. And we received budget from Netherlands. And that project, they would like to do scale up nutrition sensitive agriculture in the mountainous areas in Laos PDR and in Vietnam. And this once again is a project in Laos PDR and also in parallel in Vietnam. And from Laos PDR, it was conducted in Nong district, Savannakhet. The question that we use for this research project, we would like to know what are the main contributing factors in under 5 mortality in the target area. And since we know that there are many different contributing factors for malnutrition, and we would like to know what are those factors, why some mothers are doing better than other mothers, even though they are living in the same condition, in the same location, why some families have better health outcome. And now moving on to methodology. I use mixed method. So this include anthropometric measurements of children under 5. And we do that. Actually, initially we aim for 20 villages, but given the limited budget, it was down to 6 villages. And in addition to anthropometric measurements of children under 5, we also have household questionnaires and observations of the household. We also have interviews and focus group discussions. So the interviews was conducted with health workers and family members, and the focus group discussion was conducted among mothers and also men in the villages. We also have the individual interview as well. And here are the results. The total population is 264 families, and these families comprise of mother, father, and children under 5. And out of these 264, more than half of the children under 5 are stunted. So stunting is a real concern in the research area. And when we look further, we see more male than female with stunting. And when children were under 1 or 2, the malnutrition was not bad, but after 3 years old until 5 years old, malnutrition seems to be more severe, especially during 4 to 5 years old. And this is the result from our observation. And severe malnutrition seem to be happening around 4 to 5 years old. Now, when we look at the practices and the underlying factors, starting with feeding practices, from the research, we found that feeding practices is one of the issue, and we found that inadequate feeding practices were prevalent. We found that let me give you example of the positive deviant mother. They reported that the children cannot skip rice or meal, so they have to buy food and rice. Now, in contrast, when we look at the family with malnourished children, they said that they just feed their child with rice if they have it. In some days, when they don't have it, kids skip their meals. And usually, when children, they have their food, they have the same food as their parents. And this is reported by the family with malnourished children. And when we look at the care and hygiene practices, we ask them about whether or not the family visit the health center, whether or not they have vaccination, whether or not they boil their water, or they have washing practices. And overall, we found that the positive deviant family, they have better care and hygiene practices compared to the rest of the family. And this include better in visiting healthcare, vaccination, boiling water, and hygiene practices. The parents who have better understanding of what they were taught before tend to have better healthcare attendance, vaccination rate, boiling water, and wash practices. And the focus group reported that when they stay at home, they boil water before they drink it. But if they are at the field for work, they just drink fresh water directly because they don't have time to boil water. And this is reported by both positive and negative deviant mothers, parents. Now, looking at household food security, we observed that 90% of the families face food insecurity. However, the positive deviant families experience food insecurity for a shorter period compared to the negative deviant families. For example, say 12 months in a year, the positive deviant family can be self-sufficient for 10 months. And they may be in food insecurity for 2 months. Oppositely, the negative deviant family can only have food security for half of the year, for 6 months. So, the both positive and negative deviant family depend on their own food production and also receive help from their relatives. When we interviewed the negative deviant mother, they reported that we try to gather food from the nature and hunting for animals, but someday we managed to have food. Other days we return home with empty hands. Some days only little veggies. In Nong district, the situation is different now. It is more difficult for people to gather food from the nature. Now, when we look at the positive deviant family, even though they have food shortage in some time, they ask for rice and food from their cousins, their relatives, and sometimes they use the techniques of exchanging food with friends or trading food with something else so that they can get food to feed their kids. And this is how they use the strategy when they have food insecurity. Now, moving on to another factor, knowledge overall. Both two groups, positive deviant and negative deviance, understand the importance of hygiene, sanitation, nutrition, food, and vaccination. In the research area, they did not have high level of education. So the way we ask questions, we show them pictures. And most of the time, the respondents can answer the question. And both of the two groups experience problems to follow the advice of the health worker or the project team. For example, on dietary diversity and different other topics that they were taught. So overall, they understand how important it is. However, they are struggling to follow the advice. Some of the tools are quite technical and it is quite difficult for them to understand what the topics are really about, and so that they are struggling to follow. Now, moving on to the next factor, motivation and attitude. So we looked at both motivation and attitudes. We learned that motivation and perseverance are very important to ensure that their children stay healthy and has better future. And the positive deviant mother reported that they try to make sure that their children can eat according to the feeding principles and try to prevent their children from being malnourished. They try to feed them from time to time. They make sure that their children eat frequently. And when they observe that their children are chubby, they understand that, okay, this is okay. And positive deviant mother tend to think ahead or think about the future more often. For example, before they are going to their rice field, they pump breast milk into a milk bottle or a bag that was provided. But for the negative deviant mother, they only think about what would they eat for this meal. They did not tend to think ahead. They only think about the present. What are we going to eat for this meal? And from our experience of working in Nong district, we misunderstood. We thought that they have 3 meals per day, but actually many ethnics do not have the same practice. They had breakfast between 9 to 10 a.m. So between 6 a.m., the wife hunt for food from outside, and the husband actually wait at home and take care of the child. So they managed to have breakfast at 9 a.m., 9 to 10, and then they skip lunch, and then they have dinner, early dinner around 4 p.m., 4 to 5. And we did not realize this, but when we asked them, what do they eat in the morning, what do you eat for lunch, what do you eat for dinner, and these questions are not quite relevant to the practice. And now, when we look at gender equality and women empowerment, which is also one of the main factors, we look at the differences in the gender role between the positive and negative deviant families. We learn that in the positive deviant family, the husband support in taking care of children. They also try to making sure that their children are not too skinny, because skinny means weak, and they feed fruit to their children. However, when we interview the rest of the family, the husband tend to understand that this is not their job. Taking care of children, cooking are the job of his wife, and they believe that it is embarrassing if the husband do the job. And they understand the clear gender divisions of roles. If they are supporting their wife with housework or taking care of children, it means that they are afraid of their wife, because normally this is not their job. But for positive deviant family, the female member of the family tend to be more, have greater autonomy. They are more confident to speak to their husband. They also don't have communication issue when they speak to us. They feel that they will receive support from us, so they don't have any hesitant to talk to us. They have greater autonomy compared to the negative deviant family. Now, moving on to the social support and time allocation. We observe that the positive deviant family experience more social support compared to the rest of the family. In the positive deviant family, the husband like to provide support, like making basket and box for steaming rice. Both men and women work and support the family. However, the rest of the family, the wife get to do meal rice, collect water, and if she does not do that, her husband will be angry at her. But at the same time, the husband didn't do anything, only eat and sleep. We observe significant differences between the positive deviant family and the rest of the family. The positive deviant family, the husband provide great support. When we conduct interview, we learn that the husband provide a lot of support. Oppositely, the rest of the family, the husband did not care. They believe that it is woman's job. For example, grounding or milling rice. When I provide support, those husbands laugh at me that this is not men's job.
ครอบครัวที่เข้าใจในปัญหาของการพัฒนาการโดยเฉพาะเป็นทางนำของเรียกที่นักหลัก
But at the same time, for the positive deviant family, the husband provides support, collecting water. And right now, even better, when they have motorbike, they use motorbike to collect water.
เขาสนเทียบมาหลังจากการ
Now, moving on to discussion. How can we interpret the results? We see that Nong district does not yet have impact from the national reduction in stunting. At the time when we conduct the research, stunting was in 55%. But provincial average at that time was 28%. So Nong district is in Savannakhet province. And in the bigger cities, the stunting level was not too bad. But there are also big discrepancy between districts in Savannakhet province. For example, in the bigger city, stunting rate was low, but in the less or in the remote city like Seno, the stunting rate was high. When we look at LCIS, we need to look as well more specifically in Nong district, which particular area that we look at, because the rate of stunting also different. Now, when we look at the average stunting set score, we saw that it was lower after the first 1,000 days among children under 5, which this result also found in the research in Ghana. Now, when we look at qualitative result, how can we interpret? We learn that we need to double the efforts of practices to make the outcome sustainable. In terms of social support, it needs more social support to improve the issue. Same goes to motivation. Same goes to autonomy. So these are the factors that needs to do better in order to improve the problem. Now, in conclusion, the positive deviant family, if they understand care and feeding practices, at least we see better results for the remaining family. We saw from the positive deviant family how they seek support from their families, their relatives, how they care about the status of their children. They also have the vision, what they would like to see and what they don't want to see in their children. So with this kind of attitudes, needs, it leads to better outcome. And moving forward, first of all, we need to understand better, especially we are looking at this study in depth. maybe there are more discrepancy between districts. We also would like to have more qualitative information to validate the outcome. And for this, a family-centric approach should be used. For this kind of problem, we need family-centric approach. Focus is not only on the mother or the child, but we need family efforts. And also, previous research also shows that intervention focusing on both father and family and social support are important. We talk about the family-centered approach, and this includes mother, children, grandparents, decision makers in the family, and especially some ethnic groups, they still rely on the elder person in the family, and they tend to listen the elder in the family. And finally, from my experience, it also changed my perspective. Before, I only focus on 1,000 days, children in the first 1,000 days. But from these studies, I learned that children among the first 1,000 days, they already well. But those after 1,000 days are also the problem. So I learned from this experience that we only focus on children in the first 1,000 days. But after 1,000 days, those children sometimes, most of the time, not sometimes, they eat with their parents, they eat with their grandparents. So these children, if they have food available, then they get to eat with their parents. But if not, sometimes they get to skip their meals. So in the nutrition sensitive agriculture, I also learned that in a neighboring country like Thailand, they also focus on children under 5 instead of only the first 1,000 days. And that concludes my presentation. The floor is open for questions and comments. I will try my best to answer the question. If any question I cannot answer, then Dr. Latiporn, my colleague, will also support. Thank you. Any question? The floor is open for questions and comments. Any question? There's one hand. Okay, Jansatit, your hand is up.
ถ้าถาม
Please
อันนี้จะเบิ่งคือกันย่านผู้เพิ่นนั่นสปอร์ตทางด้านสนักการก็สิถาม
สบายดี
ได้ว่าสิบอก
Okay, allow me to ask my question. First of all, thank you very much for the presentation. This is kind of new approach, especially the positive deviant approach. I also have heard about this, but I have not applied it in my research. I have a few questions that I need to clarify. The first one, in terms of the positive and negative deviance, are we looking at the practices? So are we looking at the care practices in combination to the nutrition status of children under 5? Do I understand correctly? So with these two factors, it leads to positive deviant family. Let me clarify for the positive deviant family. So actually, we have a team who work in the village, and we have the list of children under 5. And we know that which families have malnourished children and which family does not have malnourished children. And then we compare these two families. So we conduct the interview. The family who are living in the same socioeconomic status, for example, they are living in poverty, but some they are living in poverty, same condition, but some families have better nutrition outcomes. And we look at different factors, for example, care and feeding practices, health-seeking behavior, vaccination, and hygiene. Okay, thank you. If we look at the proportion of the positive deviant family, so the family who are living in poverty, but they have better nutrition outcome, do we have any proportion how and the share of them, how much of them? Thank you. When we conduct the survey, we did not focus on quantitative because we only have, I think, 140 each family, 140 family. So we did not compare the proportion. We did not test to see the proportion. So we look at overall who are the positive deviant and negative deviant, and then we selected some families of the positive deviants and negative deviants, and we understand the underlying factors. We also have quite a significant limitations of the budget. Okay, thank you. My second question, we found that stunting rate is quite high, 45%, between severe and moderate stuntings. I would like to ask about this. In LCIS, stunting is about 37%, so it's still the burden. What about wasting? So, for example, SAM or moderate acute malnutrition, do we have the proportion, or you have it but you did not show in the table? Yes, we do. We do have that. We do have that figures, but we have to select which one we need to focus. So, so we have stunting, wasting, underweight, but we focus on the most severe one. When we look at different other projects, we learn that they focus on wasting and underweight, because stunting takes time, but for us, we challenge ourselves. We would like to see a reduction in stunting. When we look at the nutritional status, it is only the criteria for us to select the positive and negative deviant families. When we work in Nong district, we work at the extreme condition. if you remember the family who have food insecurity, they only, so 90% of them have food insecurity. This means that less than 10% of the family who have food security. I understand that the samples cannot represent the whole countries, but it can represent our methodology. I would clarify that way. Anthony, please. Okay, your next question. I actually have one more question. We know that Nong district is the district that is still in poverty, and then when you conduct survey, you also look at the wealth index, because we can then categorize them in quantiles, because we would like to see the correlation between nutrition and wealth index. Yes, when you go to Google Scholar and then you put my name, you will see the first paper. We already have that. But for Nong district, poverty rate is very bad. I would say so. When I publish my paper, I narrow down the scope. But to answer your question, yes, I also have the wealth index. You can see in the first paper that I published in Google Scholar. Thank you very much, Anthony. Please answer your question. Please ask your question.
Hi, thank you so much. Very interesting study, and congratulations on the interesting results. I have two questions. The first one is for the food insecurity. How did you measure the food insecurity? Because 90% is very high, and I understand the small sample size, but would be very interested to hear how you measure the food insecurity. And my second question is on the gender roles and the differences between the two families. Was there any reason why there was the difference in the gender roles? Was there any reason why some families had more of the gender equal relationship versus some other families? Yes, yeah, absolutely. I was just curious to know the tool you used. Yes, absolutely. Thank you so much. I just have one other quick question. What is the timeline for the full report to be published? Okay. Thank you so much.
I'm Ponsai from TSI. Thank you very much for the presentation. So from your presentation, you said that the positive deviant family received support from the husband, but for the negative deviant family, the husband did not help. Are they from the same ethnic group? Between the positive and negative deviant family, are they from the same ethnic group? And in the what about the positive deviant families in which the husband provides support? What did they do? Why their husbands did not feel embarrassed to support their wife? So I just would like to understand why there are differences here. Thank you very much. That is a very good question. In Nong district, there are different ethnic group, Ta Oi, Mangkong and Ta Oi. And they both in Kumu ethnics. In the positive deviant families, actually they have been evolved, they've changed. In 2016, it was not like this. At most they only cook rice in the morning, but the wife was the one who went outside still. When we have the nutrition sensitive agriculture training, we also have gender component, or we call it gender empowerment component. And we try different approach. For example, we provide training to them. We have them receive training at the same time. And we try to have mix both men and women, but initially they separate themselves. They don't sit together, even though we try to mix them together. So the training was on gender roles, women empowerment. And later on in 2017 to 2018, we have the village development plan for nutrition. And then we invited both husband and wife to plan for village development. For example, household garden, livestock, and it seems to be better. We observe progress during the planning process, and finally we try to improve this. But for this one, we did not want to get data. We provide them with skill. We ask them every week to weigh their children each week, one time per week. And we start to see differences among men. And we see that from the cooking demonstration, men try to show better support in the cooking demonstration. They carry stuff to support their wife. I'm not sure if this would answer the question of Amponsai. I see. So we can see that this is actually not happened initially, but the changes came from the intervention, right? Yes, but this only happened in some family, I would say. Some remain the same. And this may also contributed by the other agricultural activities. So they have banana farm, and when they are selling bananas, it is the wife who sell banana in the market, but the husband support with carrying banana. And then they also have the cassava production together. So I would say it also contributes to better gender division of roles in the family. Dr. Jansathit, for the chronic malnutrition or stunting, I saw in your presentation, also on the feeding practice, did you also look at the dietary diversity for individual child? You will see that in my latest paper, we did that. You will see that in my paper. But the problem is, for the household, we don't have standards. So, but I did that for mothers and for children. What I use is the 24 hours recall and also the tools by FAO. But for the DS, that is only for women and under 2 children. That would be one of the limitation, and would lead to how can we improve in the future. So BBS, this is for under 2, right? But under 5, you did not look at the dietary diversity. No, actually under 5, we collect data for under 5, but standards we use under 2. Okay, got it. Thank you. I see. And this is the problem that we did not discuss before. We realized that this is the research gaps. And today, my team went to Sieng Kuang province in Pek and Pukut district. They look at the dietary diversity for women and children under 2. And in the future, when we have data, we are going to present it. we call it agricultural or ecology for nutrition. Dr. Latiphon, are there other hands right now? I did not monitor this. In fact, if you have questions and you don't feel like asking here, feel free to send me an email. I'm more than happy to answer your questions if you could not think about anything now. Dr. Anison, actually, you unmute yourself. Please go ahead. Okay, if no further question, then I'm going to hand over the floor back to Nutrition Center.
Sabadi, ข้าพเจ้าสิทธิพร สุริวงศ์จากหน้าของ
Sabadi Siddhipon on behalf of Nutrition
เพราะว่า
Center.
อันนี้เป็นคือว่าเป็นการแลกเปลี่ยนข้อมูลโดยที่มันทางอาจารย์ Sayvisene เพิ่นได้มอบข้อมูลในการ
the
ประกอบ
great
ของเพิ่น
session
ถือว่าเป็น
from
เวียกงานหรือว่า
Dr.
เป็นข้อมูลที่สำคัญ
Sayvisene Boulom very
ที่ว่าได้นำเสนอในเฮามื้อนี้ และก็หวังว่าบรรดา
results.
ข้อมูลต่างๆที่ว่าที่
I hope
ทางอาจารย์
that
เพิ่นได้นำเสนอมานี้จะเป็นประโยชน์ใน
it
การ
is
ให้สนองข้อมูล
useful
ให้ทั้ง
for
สา
everyone,
การเฮาที่ได้เข้าร่วมในมื้อนี้ และ
for
ตามที่เฮาได้
those who
ปฏิบัติกัน
participated
มาคือ
today.
วิดีโอมื้อนี้เฮาได้มีการบันทึก
And
แล้วจะมีการ
as
อัพพูด
usual, it
ลง
is
ใส่ใน
recorded today.
ลงใส่ใน YouTube
The
ของ
Zoom
โครงการ
today is
ANRCB
recorded, and
เฮา
we are going to
ฉะ
put
นั้น
it
ว่า
in
หากว่ามีการ
our
สนใจเพิ่ม
YouTube
เติมตาม
page.
ที่หลัง
So
บรรดาท่าน
later
สามารถ
on, if you have
เข้าไป
any
เบิ่งในระบบ
questions,
วิดีโอใน YouTube
feel
ของโครง
free
การ
to
ของพวกเราได้
watch
แต่
the
อีกอย่างหนึงก็ขอ
recorded
ขอบใจมาทั้ง
videos in
อาจารย์
YouTube.
Sayvisene เพิ่นที่ว่าเพิ่นส
I
ละ
would
เว
like
ลา
to
ได้เข้า
take
มา
this
ให้
opportunity
ข้อมูล
to
ในมื้อนี้
thank
และนำ
Ajahn
เสนอในมื้อนี้
Sayvisene
ขอขอบใจหลาย
for
ๆ
your
ท่านอาจาร
time
ย์
presenting
และก็ขอขอบใจ
your
บรรดา
research
ท่าน
today. Thank
ที่
you very much
เข้าร่วมในมื้อนี้
also
ที่ได้สละเวลาเข้าร่วมรับฟั
all
ง
the
นำและหวั
participants
ง
for
ว่า
your
ในอาทิตย์
time
ในเดือน
joining
หน้า
today.
จะได้รับ
And we hope that
เข้าร่วมและพบกันอี
we
ก
are
ในเดือน
going
หน้า
to have your
ท้ายนี้ขอ
participation
ขอบใจ
again
บรรดา
next
ท่านและ
month.
ขออวยพรให้บรรดา
Thank
ท่าน
you
จง
very
มีสุ
much
ขภาพ
once
แข็งแรง
again, and I
ประ
send
สบ
you
ผล
well
สำเร็จใน
wishes,
หน้าที่เวียกงาน
great health, and success in your important work. Thank you very much.